All right. Welcome to our second general meeting for winter quarter. This quarter, we're kind of going to get back into like more neurodisorders, and we're also going to be talking about various like treatments and therapies and things like that. But for now, we're going to start off talking about a neurological disorder, which today we're going to be talking about Alzheimer's. And the presentation was put together by our seminars and research squad from Education Committee. So hats off to them. They did a really good job on that. A few reminders and icebreakers. We are continuing our trivia fundraiser. I think yesterday, today, and tomorrow, Education Committee are posting on Instagram and trying to raise as much money as we can. And our trivia tournament is scheduled for the 15th, and we have a few wonderful people who are going to be representing hand. So we'll wish them luck when time comes closer for that. Mentor-mentee forms are still open, I think. So if you want to fill that out either as a mentor or a mentee, be sure to get that in as soon as possible. And guest speakers, we have a few updates. We are confirmed to have Dr. Mayo speak with us on February 16th and Dr. Basso speak with us on March 9th. So we have a few different guest speakers coming in who will be talking about different kind of areas of expertise, and we should enjoy hearing about them. And I think for Dr. Basso, we'll also do a journal club just so that we can learn a little bit more about what kind of research she does and if we have any specific questions for her. That way we have something to talk about when she comes. And we have an icebreaker fire fuel question, which is, are hot dog sandwiches and does cereal or milk go first? So I don't know. Do you want to make breakout rooms just so we can talk, or yes? Okay, let's do that. I will stop share and I'm going to create, let's see, there's 38 of us. So let's do like 10. Okay. I'm going to create like 10 breakout rooms. So hopefully it should be asking you. Okay, good, passionate discussion. Hopefully it was a good learning experience. And now I'm going to transition it over to Seminars and Research Squad from Education Committee to talk about Alzheimer's. So whoever wants to jump in is welcome to.
All right, so today we'll be going over Alzheimer's disease, which is certainly one of the most well-known and one of the most prevalent neurodegenerative diseases out there. And so hopefully by the end of this presentation, you can learn a little more about what the disease is, how it affects patients, and what research is being done to hopefully treat this devastating illness. So first, we'll just start with an intro to Alzheimer's. So we'll be playing this short video, which just provides a general overview of the disease, some of the history and general causes and symptoms.
Every 4 seconds, someone is diagnosed with Alzheimer's disease. It's the most common cause of dementia, affecting over 40 million people worldwide. And yet, finding a cure is something that still eludes researchers today. Dr. Alois Alzheimer, a German psychiatrist, first described the symptoms in 1901, when he noticed that a particular hospital patient had some peculiar problems, including difficulty sleeping, disturbed memory, drastic mood changes, and increasing confusion. When the patient passed away, Alzheimer was able to do an autopsy and test his idea that perhaps her symptoms were caused by irregularities in the brain's structure. What he found beneath the microscope were visible differences in brain tissue in the form of misfolded proteins called plaques and neurofibrillary tangles. Those plaques and tangles work together to break down the brain's structure. Plaques arise when another protein in the fatty membranes surrounding nerve cells gets sliced up by a particular enzyme, resulting in beta amyloid proteins, which are sticky and have a tendency to clump together. That clumping is what forms the things we know as plaques. These clumps block signaling and therefore communication between cells, and also seem to trigger immune reactions that cause the destruction of disabled nerve cells. In Alzheimer's disease, neurofibrillary tangles are built from a protein known as tau. The brain's nerve cells contain a network of tubes that act like a highway for food molecules, among other things. Usually, the tau protein ensures that these tubes are straight, allowing molecules to pass through freely. But in Alzheimer's disease, the protein collapses into twisted strands or tangles, making the tubes disintegrate, obstructing nutrients from reaching the nerve cell and leading to cell death. The destructive pairing of plaques and tangles starts in a region called the hippocampus, which is responsible for forming memories. That's why short-term memory loss is usually the first symptom of Alzheimer's. The proteins then progressively invade other parts of the brain, creating unique changes that signal various stages of the disease. At the front of the brain, the proteins destroy the ability to process logical thoughts. Next, they shift to the region that controls emotions, resulting in erratic mood changes. At the top of the brain, they cause paranoia and hallucinations. And once they reach the brain's rear, the plaques and tangles work together to erase the mind's deepest memories. Eventually, the control centers governing heart rate and breathing are overpowered as well, resulting in death. The immensely destructive nature of this disease has inspired many researchers to look for a cure, but currently, they're focused on slowing its progression. One temporary treatment helps reduce the breakdown of acetylcholine, an important chemical messenger in the brain, which is decreased in Alzheimer's patients due to the death of the nerve cells that make it. Another possible solution is a vaccine that trains the body's immune system to attack beta-amyloid plaques before they can form clumps. But we still need to find an actual cure. Alzheimer's disease was discovered more than a century ago, and yet still it is not well understood. Perhaps one day we'll grasp the exact mechanisms at work behind this threat, and a solution will be unearthed.
So it's estimated that there are approximately 44 million people worldwide living with Alzheimer's disease or a related form of dementia. However, in the US alone, an estimated 5.5 million people of all ages have Alzheimer's disease. Of these, around 5.3 million are 65 and older, and 200,000 are younger and have early onset Alzheimer's. So as you can see, elders are disproportionately affected by Alzheimer's. Alzheimer's is also the sixth leading cause of death in the US, killing more people than breast cancer and prostate cancer combined. Since 2000, deaths from Alzheimer's have also increased by 89%. Furthermore, 1 in 3 seniors die with Alzheimer's or another dementia, and typical life expectancy after an Alzheimer's diagnosis is 48 years. Next slide, please. So scientists still haven't fully understood exactly what causes Alzheimer's disease, but the basic understanding is that brain proteins fail to function normally, which triggers a series of toxic events that damages neurons. This causes them to lose connections to one another and eventually die. This dysfunctioning of brain proteins can be caused by a combination of genetic, lifestyle, and environmental factors that affect the brain over time. Scientists that study Alzheimer's are particularly interested in the role of beta-amyloid proteins and tau proteins in the onset of this disease. When beta-amyloid proteins cluster together and form amyloid plaques, they appear to have a toxic effect on neurons and to disrupt cell-to-cell communication. Similarly, tau proteins that are an integral part of a neuron's internal support and transport system change shape in Alzheimer's patients. They organize themselves into structures called neurofibrillary tangles, and these tangles disrupt the transport system and are toxic to cells.
So this image shows a crosswise slice through the middle of the brain to show the physical effects of Alzheimer's. Some notable effects are the shrinkage of the hippocampus, the expansion of ventricles, and the shrinkage of the cerebral cortex. Shrinkage in the hippocampus and cerebral cortex increases as neurons continue to die. By the final stage of Alzheimer's, damage is widespread and brain tissue has shrunk significantly. Next slide, please.
Most people diagnosed with Alzheimer's, they have the late onset variety, meaning that their symptoms first start to appear when they're in their mid-60s. But for those with early onset Alzheimer's, symptoms can start showing up as early as mid-30s. And similar to the diseases that we've discussed before, like Parkinson's and Huntington's disease, symptoms of Alzheimer's result in problems like cognition, behavior, and movement. So for example, some symptoms include memory problems, impaired reasoning, problems coping with new situations, and really dramatic mood and personality changes, as well as restlessness and repetitive movements and muscle twitches. And Alzheimer's, it progresses in stages. So there's mild, moderate, and severe Alzheimer's. And as the disease progresses and the patient gets older, the patients have a harder time completing tasks that they were once able to do. The symptoms affecting their behavior and movement become a lot more apparent. And patients start to have less and less control over their language and behavior until they progress into the severe stage where many patients are unable to communicate. They spend most or almost all of their time in bed because they're unable to move their body and are completely dependent on others for their care.
Okay, so Alzheimer's can truly only be diagnosed after death, and that too is by closely examining the brain with a microscope. But usually physicians use family medical histories and certain tests to identify cases. And so going through these tests, a physical and neurological exam often tests a patient's reflexes, senses, balance, and coordination. Blood tests are used to rule out other causes of similar symptoms, such as vitamin deficiencies. And MRIs, CT scans, and PET scans help rule out other conditions that also affect cognition, and those include strokes and tumors. Next slide, please. And as of right now, there is no cure for the disease, but there are some treatments that have been approved to help manage symptoms and progression of the disease. So cholinesterase inhibitors are the most common drug used for Alzheimer's symptoms, and they're pretty effective in improving mood, but they also do have side effects for patients. There have been several alternative medicines derived from herbal remedies or vitamins that have been tested on Alzheimer's patients. And these include vitamin E, omega-3 fatty acids, and some hormone therapies as well. But unfortunately, none of these treatments have been very convincing in trials. It's also very important for family members and friends of patients to create a safe and supportive environment for the patients. By eliminating safety risks around the house and giving them a lot of positivity, it can help them continue to do daily tasks and also feel productive, which in the end will greatly increase their mood. And lastly, current research is being done on future treatments, but this will be talked about later on in the presentation. Next slide.
Okay, so this video basically shows a real life example of two people who have been diagnosed with Alzheimer's. And it basically shows how Alzheimer looks different in different people. And it shows how these people, they can remember how to do different things. And there's different things that they've forgotten. But what's really interesting and something that you guys should notice is how they've adapted their lives even after being diagnosed with Alzheimer's.
I am 66. I was diagnosed when I was 65.
I was diagnosed initially in November of 2015, and I think I'm getting the dates right. Part of my issue is my dates sometimes mush together.
I know exactly what we're doing. I know you're Steve, I know you're Zach. We're here in Pine Street finally.
On July 20th of last year, I received the official diagnosis with 17 research physicians and doctors in the room, myself, my husband, and my 2 children with the diagnosis of early onset, early stage Alzheimer's.
And you can take a minute if you...
Every time I say it.
The way I explain it to people is I am in a new life. My former life no longer exists, and it's up to me to create a new life.
I knew something was wrong. It's not normal to not be able to calculate a tip anymore. It's not normal to not do math in your head and to be able to subtract or add numbers. It's not normal to not remember conversations or to attend a training class and not remember what was taught.
More and more words are going away, and there are a number of words that no matter how I remember them, they are not there. You know, I could say, okay, now I've got it, and two minutes later, I won't have it.
With Alzheimer's, you don't have an option. It's just not there. The information is just gone.
It seems to be particularly difficult for those of us with Alzheimer's early onset to have, sorry, I got a little bit. Okay, where was I?
Frustrating is the word that comes to mind. I am frustrated with the fact that I don't know what 32 minus 7 is without a pen and paper. It frustrates me that I have no idea what today is, but I do know it's Friday.
First thing I lost was my car, so I was no longer able to use my car for various reasons. I got a bicycle, and I've had 2 crashes with that, and I think part of that is spatial.
Now I have a new job, and that job is to be loud and proud about my disease, to share my symptoms with everyone and anyone who will listen to me.
I'm able to be useful, I'm able to surround myself with a lot of people, which is absolutely the most important thing you can do with Alzheimer's.
Everyone always tells me I look good. Well, what does that have to do with anything? I keep saying to people, I'm going to walk around in a bathrobe with a towel on my head. You know, no makeup, just an old hag. And then maybe then they'll think I have Alzheimer's. But this is what Alzheimer's looks like. It looks like me.
My name is Chris Hannafin.
My name is Pam Montana, and this is my brief but spectacular take.
Brief but spectacular take
on living with Alzheimer's.
I am 66. I was
All right. Now we will be discussing some ongoing research on Alzheimer's disease, both globally and at UCLA. So the major research finding that is waiting on approval from the FDA is Biogen's aducanumab drug for the treatment of cognitive decline in early Alzheimer's disease. Essentially is an injectable antibody which removes amyloid beta plaques, which, as we discussed earlier, are proteins that build up in the brain at an early stage of the disease process. So the diagrams on the bottom actually demonstrate the different ways through which the antibodies alert the immune system to clear amyloid plaques or prevent its formation altogether. And this leads to healthy neurons in the brain. With this drug, the phase 3 clinical trials results did reveal that the drug actually slowed the decline of cognition in patients. And we've actually never been this close to the approval of a medication for Alzheimer's that could actually slow the progression of the disease. But recently, in November, the advisory panel of the FDA actually disapproved of the drug since study data was not consistent enough. But the actual target action date is in March for the FDA to discuss on the medication. And if disapproved, it will just need to supply more data of its research. Next slide, please. Okay, so now focusing on research at UCLA, most of these projects are actually occurring at the Mary S. Easton Center for Alzheimer's Disease Research at UCLA. And one research focus is actually preventing the accumulation of toxic proteins like amyloid beta. Dr. Galbaton is focusing on the molecular, which Dr. Bronson is actually a collaborator, and he's focusing on the molecular interactions that happen before the formation of the beta plated sheets in the proteins altogether, which is similar to the global research medications that Biogen was doing. And then another research focus is suppressing tau protein pathology in the brain. So when abnormal chemical changes occur in the tau protein, it detaches from the microtubules and sticks to other tau molecules. And what happens is that since they stick together, they eventually join to form tangles inside neurons, which doesn't allow for communication between the neurons. And so what happens is this study is aiming to develop disease-modifying therapies using inhibitors, which would block the tau pathology, which is propagated by 2 enzymes. I'm not sure how to pronounce them, but they're on the slide. And then a last area of research involves the drug discovery lab at UCLA Neurology. And they're undergoing clinical trials for the drug DDL-110, which interacts with two different receptors involved in cognitive function. It increases the SAPP alpha to A beta ratio, which elicits neuroprotection, memory formation, and also, like the other areas of research, it reduces amyloid and tau pathology in the brain, which we can see as a common theme. And once again, there is no current cure for Alzheimer's that could stop the progression of the disease, but all these research focuses hold promises for future treatments. And that actually wraps up our presentation. So I think now it's time for a game.
Yeah, so we'll be doing the Quiz Wizard activity that we did at the start of last quarter. It worked pretty well, and we kind of wanted to start to see if it works again. So just give me a second. I'm going to share the link in the chat. Okay, so everyone should be able to just have that, and I will share my screen. Okay.
Artie, I think it's saying that we need to create an account to play.
You shouldn't have to. You should just be able
You don't have to. It like lets you move on from that part.
Yeah, you just press create account and then it just tells you to put in the code.
Sounds good.
You don't need to use the link that's in the chat. You can just go to the website.
I'll give you all like 30 more seconds just to see if there's any remaining people that want to join in. I'm gonna start the game in 3, 2, 1. Also, whoever's going by raw oatmeal, I swear. Okay, Alana, I see you. Ooh, Lauren is already on feet. Brit's almost at 15. Nice work, Brit. Is that everybody? No, I think some people are still moving. I'll give people like 30 more seconds. Okay, I'm gonna close in 5, 4, 3, 2, 1. Nice work, everyone. Also, shout out to whoever raw oatmeal is. Really appreciate that. Love it, love it. Anybody have any questions? That was pretty much it. Good job to the 3 of you who made top 3s. That was Britt, Alex, and Raw Oatmeal, aka Sasha. Really great work, you guys. Great work to Seminars and Research for that amazing presentation. If anyone has any questions about the presentation or about anything else, just shout it out right now. Hopefully we can answer it. If not, I'm pretty sure Tiffany might have an announcement.
Sure. Did we go through the announcement slide in the beginning?
Yes, we did.
Okay, cool. I think I'm good on my end. Just to give an update, some of our innovation team directors and I just met with our advisor, Lee Felsenstein, about the innovation team. So cool meeting. He's honestly a goat. Also, fun fact, his work times are like, he told me 1 p.m. to 5 a.m. So I don't know what's going down with him, but he's very, very cool person. And yeah, I guess if we're ending early, I hope you guys have a great rest of your week too. Have fun at your committee meetings, and we'll see you guys next week. And trivia people, oh, good job on fundraising. Yay, amazing job. Trivia people, can you just stay after and we can discuss our strategies? Otherwise, thank you everyone else. Hope you have a great day.
Thank you.
Thank you.
Thank you. Thank you for coming.
Hello, hello, hello. Thank you to the team for, oh, we're still recording, I guess, but thanks guys for taking over.